Officials of the Ministry of Mental Health and Wellness spent the day Friday strategizing and setting priorities for addressing mental health across the Tri-Island state. The strategic retreat was aimed at establishing a stronger internal structure while outlining key goals for 2025. Approximately 30 ministry employees spanning various levels participated in roundtable discussions to ensure input from all departments in shaping the way forward. The Ministry of Mental Health and Wellness was established as a separate entity from the Ministry of Health by the current government in January last year, with the aim being to better address long-term mental health challenges in Grenada. Minister for Mental Health and Wellness Delma Thomas explained.
Cabinet will be approving the ministry as a separate entity that will provide services as it relates to mental health, wellness and religious affairs as a standalone ministry. Today's session it will enable us to focus on what we want to achieve for 2025 and beyond.
Minister Thomas highlighted that employee status and community health initiative will be key focus areas moving forward.
But we cannot talk infrastructural development if we do not talk about the well-being of our staff. So key for us in this planning session is how we deal with the issues that confront staff. There are many issues. Leading up to last year, we have dealt with many of the issues that they raise, but we still do have issues like staff contracts and staff status. And so those are issues that will be given priority. The issue of community mental health workers, we have intensified that in the year under review. And so in the new year, we'll intensify, not only provide the necessary training at the level of the community, but also ensure that our staff who are doing those jobs are trained.
Permanent Secretary in the Ministry of Mental Health, Naomi Jeremiah, outlined the next steps following Friday's retreat.
The next step is to monitor and implement and monitor and ensure that the plan that is being set out, we want to ensure that the Ministry of Mental Health implementation rate, as you know, there's a Ministry of Mobilization and Transformation, they will sometime review our implementation rate. So we want to ensure that our implementation rate are being high and that our plan and the deliverables are met on a timely basis as we're going to set out here today.
The ministry expects that the insights gathered from the retreat will guide the development of policies and initiatives aimed at strengthening mental health services across Grenada, Carriacou and the Petite Martinique. Rena Thomas, GBN News.